for 30 seconds. Don't miss.
Pay attention to the rhythm.
The AFib. A lot of people around the nation dealing with atrial fibrillation. Some of us are confident, very optimistic. Go see a doctor, don't be a statistic.
In the streets, come on, feel my heartbeat all around. In the streets, feel my heartbeat. City to city, in the streets, come on, feel my heartbeat all around. In the streets, feel my heartbeat.
We have more power than we realize. We have the power to check our pulse. We have the power to document the rate and the rhythm of our pulse. The power to take that information to a doctor's visit, sharing our findings with that physician. But that means gaining the necessary knowledge required to take better care of yourself and to help your loved ones do the same thing. When you go to visit your doctor, make sure you take along with you your pulse tracking sheet, your list of medication, explain your symptoms, including your family history.
So what brings me in today, Doc, is that since our previous meeting where you gave me the diagnosis of hypertension and diabetes, I've been very particular as far as taking your recommendations and suggested lifestyle changes with my diet. And of course, you know, I always love to exercise, so I go to the gym and manage my weight. However, I have a concern. I've been learning more about AFib. I chart my numbers every day, and I have a chart over the last 10 days, and my resting heart rate is above average.
Yes.
And so I just wanted you to kind of take a look at it and get your thoughts.
Can I see these numbers?
Sure.
Wonderful. Well, first of all, you did the right thing by coming in. And second of all, congratulations on your blood pressure numbers. Your changes are working. Your heart rate seems to be ranging from 112 to 115. But before we talk about what that means, can you describe a little bit more the conditions in which you took these numbers? Were you doing any physical activity beforehand? Were you drinking any caffeine beforehand? What were the exact conditions around the time you took this?
Usually I take my blood pressure first thing in the morning. So before I have any type of strenuous activities, or I may have a glass of water, but even prior to taking my medication.
So I want you to tell me if you've had any of these symptoms at all. Have you had any shortness of breath within this time window?
No.
Any chest pain?
No.
Any chest pressure?
No pressure.
Any fluttering sensations or palpitations or racing heartbeat sensations?
There was some minor fluttering in the chest, which was also concerning based on what I've learned about AFib.
And any dizziness or lightheadedness or feeling faint at all?
No, but I feel very tired, very fatigued, more fatigued than normal. My wife said it's probably stress, but even when I'm stressed, this is quite different.
Any stroke-like symptoms? Specifically, what I mean by that is, have you had any sudden difficulty walking or any sudden imbalance? Have you had any sudden visual problems, blurry vision, going blind in one eye or both eyes for a temporary period of time? Have you had any facial drooping on one side?
No.
Any speech problems?
Blue bish, Marnie, zim, zim.
Difficulty articulating your speech?
No.
Difficulty understanding what people are saying to you?
No.
Any weakness of your arm or your leg on one side or even both sides of the body?
No. But what I did notice is that the minor heart palpitations coincided with the
fast pulse.
right, with the fast pulse that I charted.
We will examine you. I will examine you personally, and then my nurse will come in and do an EKG. And I'll also be taking a very good look at your heart, listening to your heart rhythm, and making sure that you don't have an irregular heart rhythm, which is a sign of atrial fibrillation or AFib. So based on my exam and based on the EKG, you do have atrial fibrillation. But I don't want you to be alarmed. Millions of people have atrial fibrillation and they live completely normal lives. The important thing is that we start you on the right medications. So I will be starting you on medications for your atrial fibrillation today.
You know, I almost didn't make this appointment, but I'm so glad that I did. After meeting with you and speaking to you and having you explain to me exactly what I need to do to take care of myself, I feel so much better.
Don't be alarmed. I'm happy you came in early because that gives us a chance to diagnose it early, get you on the right treatment so that you can go about your life as normally as you have been.
Sounds good.
Very good. Trust yourself. Know your pulse. If your heartbeat feels irregular, call your physician, get checked. By doing so, you might end up saving your own life.